Meanwhile, new work to help diagnose one of the most common neurological conditions among young adults.
Yeah, multiple sclerosis can affect mobility, mood, and cognition. There's no cure yet. Treatments can bring symptom relief and even delay the disease's progression.
Yeah, Mandy Gaither explains how researchers say a change in the way multiple sclerosis is diagnosed is allowing cases to be caught earlier.
There's no specific test that can diagnose multiple sclerosis. Instead, doctors use what's called the McDonald criteria, a set of guidelines that can help rule out or confirm the disease.
So multiple sclerosis is a condition that is very treatable.
Dr. Daniel Antoneda with Cleveland Clinic says there are more than 24 approved medications that can help control multiple sclerosis symptoms and limit disabilities. But he says the disease starts years before the first attack, and the earlier patients start these treatments, the better they respond.
One of the things that we have to focus on is making sure that we get the diagnosis done early and accurately.
In an effort to do that, the McDonald criteria was updated in 2024, allowing doctors to give an MS diagnosis by using MS-specific biomarkers and MRIs to find early evidence of the disease.
We can be pretty confident that a person has MS, even if they haven't yet developed classical or typical symptoms of multiple sclerosis.
In this study, Antoneda and others found about 1 in 5 people they studied in the U.S. who wouldn't have met criteria for MS with the old guidelines were able to be diagnosed accurately and early under the updated criteria, allowing for treatment sooner.
It completely changes the panorama of what that individual's life will look like.
For Health Minute, I'm Mandy Gaither.
And in order to be diagnosed with MS under the old criteria, a patient would have had to have had an attack or present evidence of disease progression before treatment could even be started.